Hi there. Welcome back to the Kids Eating Broccoli podcast. We have a very special guest with us today, Dr. Zach Bush. And I so appreciate you joining us and taking some time to share your wisdom and some of the really cool things that you're up to these days. So thanks so much for joining us.
Thanks for having me, Dr. Brad. Appreciate it.
Yeah, you're welcome. And so let's just jump in. Maybe you could tell our audience a little bit about yourself if they don't know you or kind of some of your background.
Sure. I'm a very allopathic Western medicine trained doctor. I went through medical school in Denver, and then after graduating with my MD, went on to the University of Virginia and got specialties in internal medicine, which is kind of general adult care, both in hospital care as well as outpatient care. And then, and that's really the underpinnings of all the kind of subspecialties of medicine: cardiology, gastroenterology, renal, pulmonary, all the subspecialists. And so I practiced across all of those spectrums in both the inpatient and outpatient setting at the University of Virginia, and then went on to a chief resident year teaching there, and then went beyond that with a 3-year endocrine fellowship, studying endocrinology and metabolism as another subspecialty. And there I really studied the role of hormones and the impact of the hormone system on controlling everything from metabolism and the way in which you use fuel to build a healthy body, to the way in which you do repair, the way in which you prevent cancer, all of these things. And that ultimately took me down biochemistry and cell biology pathway of research into the cancer realm. And by 2006-07, I was really working on developing new chemotherapy compounds from vitamin A. And so I was getting to see the whole kind of spectrum of the pharmaceutical medical management environment of chronic disease. And that was my education, and I was steeped in it. Really enjoyed the potential that was coming out of that, and there was a lot of promise that we were going to discover personalized medicine where we could make everybody healthy by checking their genome and predicting what diseases they'd have and which drugs they would respond to and all this. And then over the course of the 2000s, from 2000 to 2010, suddenly discovered as a field that was a farce. We were never going to discover personalized medicine to the genome, because it was actually the microbiome, the bacteria, the fungi, the parasites, the viruses around us that really program human health more than the human cell and the meager amount of DNA that we get from our parents. And so that was a big transition that was happening for the whole world, and I was caught up in that. And so in that journey, I ended up leaving academia in 2010 to start a nutrition center in the poorest county in Virginia. I was really had a bee in my bonnet that if I could find a nutrition program that could teach the poor socioeconomic environment how to become healthy again, that we could really solve the healthcare crisis that we were in as a country. So that was my journey. I've since 2010 been running my clinics, and then in 2012 we had a big breakthrough in biochemistry, understanding the role of soil in human health, and that birthed a dietary supplement line called Restore, and the rest of the story kind of unfolded from there. Now, unexpectedly, I find myself being one of the world experts in gut health because of our experiments and studies of soil compounds and their impact on human cells and cancer cells and all these things. So that's a roundabout route to my long and torturous journey.
Yeah, that's quite a roundabout journey for sure. So considering that sort of vast background expertise and the different winding road you've gone through to get to where you are now, considering also, kids eating broccoli and what our purpose is and reaching parents, trying to raise up healthy kids or help their kids that are suffering from chronic illness and so forth. What do you think are the most vital things for a parent to understand about raising kids at this time in history?
Really it comes down to, two things: finding nutrients for a healthy body to build, and avoiding the toxins, right? Those are kind of your two big tasks. And the more you read as a parent, the more desperate this journey gets in a lot of ways, because you have so much conflicting interests out there that are feeding you conflicting information. So you've got the beef industry and the meat industry telling you that you'll die if you just eat vegetables, and you've got the vegans telling you you're going to die if you eat meat, and you've got the paleo people telling you you'll die if you eat anything that the paleo people didn't eat 50,000 years ago. And all of this just very kind of animosity built into our nutrition realm online and in textbooks and books and self-help guides and all the rest. And so hopefully in a few minutes today we can just maybe give you some simple building blocks of like, how as a parent do I build a healthy atmosphere and a household for my children? The way in which that journey might begin for you is to start to break down the food industry. Instead of thinking of macronutrients like more protein, more carbohydrates, more fats. Instead, just ask a very simple question when you walk into a grocery store: is this real food or is it not real food? That will help you, I think, decrease the amount of static and conflicting information in your environment very quickly. What do I mean by real food? Real food is something that was created out of nature at the most foundational level and was never screwed with artificial toxins, chemicals, pharmaceutical drugs, antibiotics, and the like. That really, in today's day and age, is difficult to find because even our USDA organic foods are largely sprayed with a lot of herbicides, pesticides, and the like. Now, they may not be Roundup and the typical herbicides and pesticides used in conventional gardens or conventional farms, but they remain an unnatural approach. And so it can be very hard to find really deep, nutrient-rich foods. The best way to do this, of course, is not necessarily in your grocery store, but actually at your farmer's market on the weekends, or if you're fortunate enough to have some CSAs nearby, join a community service agriculture program on a farm where you go and help pick food and you get your kids out there perhaps, and you guys get your feet and hands and fingers back in the dirt. The dirt is as important as the food growing in it. The soils there are going to introduce you back to the micro ecosystem that you need so desperately for human health. You need bacteria, fungi, viruses, parasites. You need all of this life that's out there to be represented in your body in very healthy, diversity. So getting back in touch with the environment is going to help you get to this real food pursuit very quickly. Of course, if you don't have a CSA or food farmer's market, the other option is, of course, grow the food yourself. And it doesn't take growing all of your food by any means. If you can just grow a few plants where every couple days you're out there picking herbs, herb garden is an easy place to start. You can't really kill an herb garden. So grow some basil, grow some mint, grow some rosemary, some thyme, some oregano. Get these herbs growing out there. The nice thing about herbs is many of the herbs don't require much sunlight. And so if you don't have much sun in your backyard or on the strip of dirt outside the sidewalk of your patio, whatever it is, try an herb garden to start. And that's going to get you back in touch with the land and the microbiome in unique ways. Remember, the goal is not to wash your food into oblivion either. So go out there and pick a sprig of mint and eat it right on the spot. Consume the nutrients and the dust and the particles that are on the food as well as the food itself. Everything you're getting out of the grocery store, of course, has been washed 6 or 7 times, is now being sprayed every few minutes by these spritzers that are spritzing the food with water that's all contaminated with weird bacteria and everything else. So returning to the garden is such a powerful tool. If not your own garden, then the garden nearby in your farmer's backyard.
Yeah, that's it's at the same time makes it much simpler, absolutely, and can be a little daunting if you haven't taken that step to grow food, which is an interesting thing because a couple generations ago everybody had gardens, and now we have a culture. It seems like very few people end up having gardens in their yards. So something as sort of basic and has been part of human history for so long is what you pointed to in a large way, when I ask you what the most important thing is. I think that's fascinating. And so you mentioned also, and you kind of tied it in a little bit there, but that finding good nutrition for your kids is one side, and then avoiding, the poisons essentially. Can you say a little more about that side of it?
Yeah, unfortunately, those happen at the same time. So as you find real food, you're going to, automatically be getting less toxin in there. Why are we even talking about toxins in regard to food? It turns out that's how we produce crops in the United States and much of the developed world now, is by spraying the crops directly with toxin. That's weird. That's never been done in human history or planetary history, to actually raise our food in a chemical environment. That's abnormal. To achieve that, we had to genetically modify our crops to be able to handle these herbicides and pesticides to be sprayed right on them. And so the GMO era that started in 1996 with our corn and our soybean has now spread. We have genetically modified potatoes, we have genetically modified sugar beets, and then of course the corn and the soybean. So that our staple crops that account for the vast majority of calories produced in the United States are produced by genetically modified plants that are able to suffer through to produce a crop in very toxic soils. Not only are the soils toxic, but the plant itself has now absorbed the water-soluble toxins, which include Roundup. Roundup is a very potent weed killer, It does so by functioning as an antibiotic, among other things. It kills bacteria very aggressively. It kills parasites, fungi, kills single-celled organisms very quickly. It will also kill the corn or the soybean or these other plants if we haven't virally genetically engineered that. We use a virus capsid to stick an artificial piece of genetic information into these plants so that they can maintain life despite the high levels of toxin in their cells. And so we have now got a food chain that's impregnated with toxin. The primary toxin worldwide is certainly this glyphosate, which is the active ingredient in Roundup. Glyphosate, now we're spraying over 4 billion pounds a year worldwide. The United States, we're actually decreasing every year our amount of glyphosate sprayed. We still use a disgusting like 300 million pounds. It's a gross amount, but it's less than before because it's becoming less and less effective because we've now bred through the overuse of this chemical weeds that are resistant to Roundup. And so now our farmers are struggling against weeds that are highly drug resistant, and they're killing their crops or taking over their farmland. And they're having to use now 4-DT, which is a cousin of Agent Orange, and more aggressive cancer-causing compounds as the weeds get more aggressive to try to combat this highly toxic environment of the chemical farm.
So in addition to food being real food or being, identified as something from nature, it sounds like you would want to the best of your ability, make sure it hasn't been contaminated with these, the pesticides and so forth and herbicides.
And this gets challenging. It turns out that these are water-soluble compounds, and 70% of our planet and 70% of our body is made out of water. And so there's recent studies published to show that 75% of the air in the southern United States and agriculture environments especially is contaminated with Roundup. Wow. 75% of the rainfall is contaminated with Roundup. And so here you are trying to grow an organic crop as a suffering organic farmer or a homeowner growing your own crop. If it comes and rains on you, you've just introduced Roundup, albeit in smaller amounts. So even if you're getting rained on, you're better off eating that rained on Roundup food than food that's been directly sprayed with Roundup in the course of a genetically modified crop. But it's getting extremely difficult as human beings to escape toxins altogether. Our excitement is that through our work in the soil compounds, we've found that in these fossil soils, there's so much nutrient density and a very specific nutrient in these carbon molecules that seems to combat those amounts of glyphosate that we find in our food and water systems, which is an amazing story of grace, right? Here we have soil that we're killing on the planet right now in gross amounts through chemical processing, chemical farming, and here Mother Earth provides 50-million-year-old fossil layer of soil that has the antidote to the toxicity of our environment. It's a weird story of Mother Earth. You wonder if was this whole thing a story already written in time before we got here or something, because it seems so far beyond just provision. It just seems like utter grace that nature is providing these solutions to our toxic environment.
Well, and so I met Dr. Bush at a recent conference, Autism 1, and in your presentation there, you showed some slides of, I think they were human cells, and what happens when they're exposed to glyphosate and some of these other toxins. And then, you're mentioning this nutrient in the soil and what happens when that's introduced, or, normal healthy tissue, then with the glyphosate and then with this. And what I thought was so profound was your comment about that when the cells are injured in this way, they lose communication or they lose contact with their surrounding world. And in particular at this conference, Autism 1, it's a lot about, sort of the emerging world of understanding autism, treating it, naturally and so forth, that the symptoms of these kids are mimicking, in a sense, these cells. They close in, kids who show on the autism spectrum, they close in and they don't interact with their outside world. And so, it's like all those interesting levels of communication, when you're talking about sort of the how the remedy is in the soil. It's like we've done so much to damage our environment, our soil, our children, and yet Earth, the soil, sort of this natural cycle has turned back over and given us that way to reconnect. I think it's a profound thing, not to get too far off topic, but, in terms of even social issues, political issues, global issues, there's a total parallel to the healthier we are as humans, the more we have communication with other humans, other life forms.
It's a beautiful template. I mean, we right there, you just laid it out. Mother Nature is telling us exactly how to survive as a species, and it has entirely to do with communication at the microscopic level, down here, the bacteria, fungi, and human cell interaction, as well as the macro level. And you can certainly see in our politics, the more and more inflamed the rhetoric, the more and more dysfunction in the society. And so inflammation kills us at every level, and certainly we're seeing a massive, you know, death cycle in the political realm right now, as far as just more and more polarized opposites failing to communicate. And like you said, when we add glyphosate to the small intestine and colon, we see cells blow apart, cells that seconds before were all understanding that their role was to be 1 in a trillion cells making up an intelligent membrane of the small intestine to protect the outside world from the inside world, and to deliver nutrients intelligently, absorb water, etc. Suddenly, you add glyphosate, and they blow apart. Now they're lonely, frightened, damaged cells that don't know that they're supposed to be cooperatively working towards life, and they start to move towards cancer-like morphology and characteristics within minutes. They start to get this damaged, isolated state of the cancer cell.
And so that's what is typically called like leaky gut or leaky gut syndrome. And maybe you could talk a little bit about how this leaking in your gut could lead to the symptoms we see elsewhere in the body in our children.
Fantastic. Yeah. So your membrane of the gut that starts kind of at your sinuses and runs all the way to the rectum covers 2 tennis courts in surface area. It's a massive, massive surface area. This is certainly your biggest exposure to the outside world. Your skin, for example, is only like 1.5 square meters. And so you have this huge surface area of 2 tennis courts that's covered with your gut lining. Interesting in its design, because it's only 1 cell layer thick, which is half the width of a human hair. So you have this tiny, microscopically thin layer of cellophane-like barrier system that's composed of trillions of little tiny microscopic cells, all glued together with the tight junction Velcro-like proteins. As those blow apart under pressure of glyphosate, gluten, refined gluten especially, that's been sprayed with glyphosate, we've peer-reviewed published that paper showing the synergy between glyphosate and gluten to cause leaky gut. Now the problem is your immune system is being exposed to everything in your environment inappropriately. So you take a breath of air and suddenly the pollen, the molds go right across the membrane. Instead of staying outside of your body, they enter the body quickly, and your immune system has to react. So now you have to have seasonal allergies, seasonal reactivity, environmental sensitivities. Now you have to have water and food sensitivities and everything else, because these compounds, as they enter the gut lining, small intestine, absorb into the body, they are immediately hitting the immune system. Some 70% of your immune system lies right behind that gut epithelial layer, and it gets overwhelmed by the outside world here and starts reacting to everything. There's been nice studies from the American Gut Project and beyond showing that as the microbiome collapses in a human gut, the human suddenly becomes prone to autoimmune disease, for example, type 1 diabetes, rheumatoid arthritis, all these different conditions. It's stemming from a collapse of the microbiome that leads to a dysregulation and overwhelm of the immune system that then results in auto attack. Your body has now lost self-identity, and the immune system starts to react to everything, maybe even your thyroid gland or your pancreas or your adrenals, or you're now attacking your whole body with your own immune system because there's been a loss of self-identity.
Yeah, that's profound because, for so many levels, but I mean, we ingest so much into that system, and it's kind of like, it's certainly, I run into a lot of parents who feel sort of overwhelmed by that. And I know we started by talking about going for real food and so forth. But when we look at how much younger and younger we're finding our children as a whole are showing up with these autoimmune conditions and chronic illnesses and inflammatory based, problems, it's sort of shocking. And what do you think that is? Why do you think we're seeing it in younger and younger kids now?
Largely because they are more and more sterile. And so when children are born without a microbiome, they become very, very deficient in this whole microbiome communication network very quickly, and therefore they have, profound deficiency in proteins and different, molecular signaling pathways and all of this. And so right now we're birthing an enormous amount of our children through C-sections. C-sections are an inherently sterile approach to getting a child out of the mother. historically, through a vaginal birth, that child is inheriting in the birth canal all of mom's vaginal flora, which is going to reflect her colon and small intestine flora. And she's going to have this huge, organic garden for the child to birth into. Then over time, the skin flora and other bacteria within mom and the environment at large will start to populate that child for a healthy kid. With each passing generation since the 1940s, we've passed on less and less microbial diversity because we've used more and more antibiotic. We're using about 8 million pounds of antibiotic in our children and adults in the United States just from our doctors. 8 million pounds is an extraordinary amount of antibiotic. It equates to 833 prescriptions of antibiotic for every 1,000 man, woman, and child in our country annually. That's a disgusting volume, but it's 4 times that much antibiotic used in our food. So the meat, the poultry, the pork, the lamb, the beef, 4 times more, 30 million pounds of antibiotic dumped into the system. So every time you eat a piece of meat, you're getting antibiotic through the residuals of the meat and everything else. Glyphosate, interestingly, as the active ingredient in Roundup, has never been patented as a weed killer. It's been patented as an antibiotic, antifungal, antiparasite. It kills small microorganisms, and so your doctor's prescribing 8 million pounds, your farmers are prescribing 30 million pounds, but then when it comes to glyphosate, the granddaddy of all antibiotics on the planet, it's 4 billion pounds. So disgusting amount of antibiotic being dumped onto Earth that's killing the microdiversity of our planet so rapidly now. And this is why our children are developing chronic inflammatory disease at such young ages. To put it in perspective, in 1960s, the entire U.S. population had a chronic disease burden of about 4%. So 4% of the population was diagnosed with a chronic disease. Now our children in the United States in the last 10 years carry 46% with a chronic disease diagnosis. Humans have never been so sick and have never been so sick so young.
Yeah, it's really true. And that was really part of the inspiration for making the Kids Eating Broccoli podcast in the first place. Just when my own oldest daughter was old enough that I started going places with her, preschool and stuff, and just seeing how many kids were, carrying inhalers around and had to have EpiPens. And she had a list of things she couldn't bring into the classroom on her snack day because someone might have a fatal reaction to it. And thinking of when I was a kid, it's like there was maybe one kid who had to go to the nurse's office to get something, a prescription medication. And now they're everywhere. It's pretty shocking.
It's shocking.
Yeah.
We have a sick population, and our kids are getting hit the hardest. And the fun thing, though, as dismal as that is, and we're currently 49th in the world for health outcomes, so most of the developed world is ahead of us. Certainly much of the developing world is ahead of us. Croatia is ahead of us, Chile, Peru, all having better health outcomes than the United States of America. We spend more money by the gallon on healthcare than these other countries do, and yet we have worse outcomes. And so all of that sounds dismal and is frankly a huge human tragedy. But the solutions are fortunately at hand, and that's just such an important reality that we can take back our food system. You mentioned, we used to actually grow our food. In 1945, 45% of the food chain in the United States was grown in the victory gardens in our backyards. Now less than 1/10 of the population grows there, or 1/10 of our food chain is grown in backyards. And so we created Monsanto. We created the chemical farming industry by outsourcing food to production. We stopped producing it and said, yeah, that's inconvenient to pull weeds and pick our own food. I'd rather just get it out of a microwave box and let's call that dinner. And that seems so much more convenient. Well, convenience and its belief system goes out the door when you're so sick you can't enjoy life. When your children can't breathe because they're having an allergic reaction to healthy food, it's just, we have to reevaluate what convenience means and what is the price of convenience and really start to live a more real life with real food.
Absolutely. I think that it's so profound, some of what you're saying with the microbiome, because, in the soil, I see people saying, let your kids play in the dirt, or, kids that are raised around farm animals have less allergies. And previously there wasn't necessarily a mechanism explained. There was just an observation, but to consider that it's actually, they're getting this exposure to this bacteria. What I hear you saying is that the actual act of getting out there and digging around in the dirt is as important, or maybe almost as important, as eating the food that came from that dirt itself.
Exactly right. Touching the earth, touching the animals, being in touch with your environment. It can start with a dog. A dog is a great way to get back in touch with the garden, because they go out and they dig in the dirt and they bury their own, bone, and they dig up their bones, and they're, stepping in their feces. They're eating the cat poop. These dogs are like microbiome machines. And so when they jump up in your face and lick your face, thank the dog for giving you back some microbiome that you may not have gotten in the office or sitting in drywall boxes all day in artificial air and conditioning and everything else. So the human has very little contact with the outside world in today's developed society, and that's to our detriment. And the animals can be a huge gift to us through that. If you have livestock that you can pet, if you got a horse that you can pet down the street, it doesn't even have to be your animal, but if you can volunteer once a week in a horse stall, volunteer to help feed cattle at the local co-op dairy or whatever it is, like, get to the livestock, touch these animals, get to the real microbiome again, and you'll see your health and your ingenuity improve. Your own kind of sense of self and your creative capacity will increase by returning to that natural contact.
Makes a lot of good sense. So in kind of getting towards wrapping up, I'd love for you just to share something that I took away from listening to your presentation at Autism One, when you were talking about, well, I guess both the sort of size, if you will, of our microbiome relative to ourselves as humans. You mentioned that we're 10% human cells, but even less so in terms of genetic information, and then sort of leading to the importance of that diversity. Because I think that a lot of people I run into are getting a sense that your gut bacteria are important, and so then they will go buy a probiotic and start taking that and think, check that off the list. And I think there's a little bit more to that story.
And clean up the body and do detox, and every function that you would want is ultimately done by an enzyme in the body. And it turns out that 90% of the enzymatic work done in the human body is done by a bacteria. And that hasn't even taken into consideration the scope of the fungi. We just have not studied the role of fungi in the human ecosystem well at all yet. It's a burgeoning field. It's just starting to begin. We're starting to find out that as part of the damage control in Alzheimer's brain, for example, the area of the brain that's damaged by the Alzheimer's disease will call in a specific fungus to have these mycelium growing around our own neurons. These fungi move in to try to do damage control and return nutrient and oxygen delivery to our own neurons. So it's a fascinating new journey into this world of the microbiome as we start to realize there's not an enemy against us in the bacterial world. There may be imbalance at moments that look like infection or overgrowth of some species or another, but ultimately they're serving an important niche within our complex ecosystem. And so we are broadly outnumbered by the world of the microbiome around us. There's an estimated 125 trillion genes in the world of the fungi, and there's only 20,000 genes in the human genome. So 20,000 versus 125 trillion. We just can't compete with that kind of genetic diversity and intelligence out there. If the fungi and the bacteria didn't want us here, we would not be here. There's just no question that they are for us and supporting life on this planet.
Yeah, that's a profound sort of turn on its head of the sort of what we've been taught about germs and bacteria and all that stuff. And that was, I think that's some of the most interesting stuff that in terms of what you presented at the conference and what I've heard you talking about too. And I think it has the potential to sort of hopefully change how we view our own health in a dramatic way. So
thanks for having me on, Dr. Brad.
Yeah.
Thank you all for listening, and thank you for your tough pursuit of health in your household. We honor you for that journey. We honor all the dads this weekend on Father's Day and all that. So best to all of you there.
All right. Excellent. Appreciate it. And we look forward to, and I should say for anyone listening, who want more from Dr. Zach, I was in preparation for this interview. I just typed his name into YouTube, and there are countless interviews and videos. And so you can kind of go down any of the roads that we touched on today and learn more, because you'll find, like I did, he's a wealth of information about all this kind of stuff. So appreciate that.
Awesome. Yeah, ZachBushMD.com will get you to the education page. And then the restore stuff is restore, the number 4 life.com, restoreforlife.com.
Excellent. All right. Well, you take care and appreciate it. Thanks so
Thank
much.
you so much. Thanks for having me on.